Okay, well, I want to thank you for coming tonight to learn a little bit about our Master of Science in Healthcare Administration program. We have been, um, we're still relatively new. We've been in existence since 2018, so we're on our third cohort of students who are graduating, and they are doing some pretty amazing things, I have to say. A little bit about the University of Indianapolis. I'm not sure how familiar you are with UIndy. We are accredited by the Higher Learning Commission. We are a private nonprofit university, and the university's mission is to prepare graduates for effective, responsible, and articulate membership in the complex societies in which they live and serve, and for excellence in leadership in their personal and professional lives. So, in accordance with that, the mission statement of our program is pretty similar. We want to prepare dynamic leaders who are going to become managers, administrators, of healthcare provider organizations so that you can effect changes, implement and refine the best practices for the field, and achieve excellence in creating a culture of health within our complicated US healthcare system. One of the unique things about our program is that you develop a knowledge of and skills within both business management and the healthcare services network. So you get the business courses, human resources, marketing, business finance. So you'll develop the skills in each one of those areas through those courses. And I'll talk to you a little bit more about that. We are located at the Health Pavilion, which is at the corner of State and this one's actually taken from, no, that's right, State and Hannah. And we are located here on the second floor of the building. All right, some fast facts. The way the program is set up, it's a cohort structure, which means that you all begin in the fall semester. I like the cohort structure. It has served me well in the past. You come into these classes, you take them together, and you become like fast friends, or it's almost like boot camp where you bond while you're taking the classes together. And it helps you create the beginning of your professional network. Once you're out on the job and you're working as an administrator, there'll be times when you have questions, or you just need referrals, or you just need somebody to talk to about what's happening on the job. Your cohort will be the people you've graduated with, and you'll be able to reach out to them as like your first line of support. We have highly competitive tuition rates. There's no out-of-state rate, and you can bring in up to 9 transfer credits at the graduate level as long as you have a B or better in the class. It's from a regionally accredited institution, and it fits within your degree plan. And you can also bring in up to 3 credits of prior learning activity credit. So if you've already worked in the healthcare sector for some period of time, then that's something we should discuss. Some of the key skills that we need for healthcare managers right now, and these are coming from professionals who are working in the field, people who have positive attitudes, leadership skills, acceptance of varied work schedules. You'll be on a salary position. You'll be overseeing a building or an organization. And so you'll be the one who's called on. And, if there's anything that comes up or anything that needs to be attended to, you have to be proactive and ethical. You need to uphold the priorities and initiatives. And these come from both within your organization, the state government, and the federal government. You'll be required to follow those initiatives, and you're going to be tasked with providing reports back on how your facility is doing with each one of those. You need to stay on top of the strategic and legal initiatives for improving the field. And part of what we do in the program is have you network with lawmakers. We'll do a couple of different brunches where you can sit and talk with them. These are the folks who are making the laws about how our healthcare system is going to work. And if they don't know how it works, then the laws aren't going to work. And the only way they understand that is from people who are working there. So part of your responsibility once you receive your degree is to provide that feedback up to the lawmakers. And when you're doing the reports from these priorities and initiatives, it becomes an iterative process where they see what's working and what's not. But those informal discussions with the brunches are really helpful. You need to be an advocate for the healthcare workforce and for the patients. So you are sort of in the middle here. You are tasked with making sure that your patients or your clients have the best care available, but you also oversee the staff who are providing the care for those clients. And you're evaluating this on a constant basis, and you're reporting it back up to the state and to the feds. So, you are really the catalyst, the workhorse to make this happen. And you need to be committed to improving yourself and your staff as professionals. Nobody wants to be stuck in a dead-end job. You want to continue to climb the ladder. So reward the staff who are doing a good job, give them continuing education, allow them to attend conferences, make sure that they are up to date on all of their skills and licenses. There is a need by the year 2025, and we're looking at that coming up really fast. It's projected that 25% of our jobs will be in the healthcare industry, and that comes out to about 2.3 million jobs. You'll find, if you look at job notices for folks who have skills in healthcare leadership, that there's always a demand, and you will, you'll be able to almost pick really where you want to be. I've got a little bit more information about the two different tracks and where you can kind of expect to start in terms of salary and rank, and we'll cover that a little bit more detail very shortly. Okay, so career opportunities. Administrators are needed in hospitals, nursing homes, and rehabilitation centers, retirement communities, and senior housing communities. We need managers in home and community-based service organizations, social services, community outreach, and education. So you've got some flexibility with what you can do with this degree. Our concentration, we have two. One is long-term care, and that includes nursing homes, rehabilitation centers, as well as residential care facilities. That would be these retirement communities or assisted living facilities. And you can become licensed administrators for that particular field. We also have a focus in home and community-based services, whether these are social or medical. So it could be home health, it could be hospice, it could be doing home delivered meals through a senior center. We know right now that the majority of people want to age in place within their own homes. And so these are services that are not going to disappear with time. They're actually going to increase. We've got an aging population that's burgeoning right now at a pace we've never seen before. And there will be need for people who understand how the healthcare system works so that they can connect people with the services that they need and can help them get referrals to other specialists or to agencies. And again, this will be part of the networking that you'll take part in as an administrator. And another reason why your cohort becomes important, because you'll be making referrals to one another once you're out in the job. So some of the facts and figures. Care coordination can be for a region. It could be like a county agency or a lead agency. Sometimes these are called umbrella agencies. If you have somebody who's being discharged from the hospital and they need to go home, you want an agency who can help coordinate the things that the person might need. So if you provide social services, you can make sure that they have home delivered meals and then coordinate all of the other services that will be in the community, whether they need home health, physical therapy, occupational therapy, if they need transportation to get to and from appointments, your agency could be the one who oversees that and manages their care to prevent them from slipping through the cracks. You handle the staffing and the budgeting, marketing, legal, billing, record keeping, and other business aspects. And your ability to sort of do the coordination and the office procedures, it's kind of up to you where your skill is and where you're comfortable. So if you're much more comfortable doing the budgeting and the record keeping, then that could be your primary, and you could delegate the care coordination to an assistant director, for example. You need to use your expertise to improve the quality of patient care services. This is an ongoing mandate from the government to continually demonstrate that you are improving the quality and the continuity of care for your clients. Salaries and compensation can vary depending on which direction you go. The Bureau of Labor Statistics last year said that the average salary was about $103,000 or about $50 per hour. It's higher for folks who go into hospital administration. And that may be an attractive option if you're looking at the salary. However, the drawback to that is once you're at that level, you can only make lateral moves. You can't really climb up the ladder. If you start off in the home and community-based services or long-term services and support. You might start off a little bit lower, but your chances for rising are much greater, and you can move up ranks within an organization, or by transitioning into newer places, or even starting your own business. So you have a little bit more latitude and opportunity with that track. I'm not saying that one is better than the other. It's just you'll see a wide range, and the range is because some of the tasks are a little bit different, and if you're starting off at the top, then you have nowhere to go but sideways. All right, so the program format, it's 36 credit hours, and it's designed to be completed in 2 years, and that includes summers. It's designed to be for working professionals, so there are 2 classes per semester. Generally, these are 8-week courses, so you would take these sequentially. You wouldn't take 2 classes at the same time necessarily. You would take the first 8-week and the second 8-week, and so you're continually in a class around that first year. We've had some students this past year who've wanted to go full-time, and that can be done. In that case, you'll be taking classes that will overlap. We do have a couple of courses that do not go 8 weeks. They run a little bit longer. The finance and accounting class will run for a full semester to make sure that you get the skills you need. And we have a course on quality improvement, and that one runs 10 weeks instead of 8. All of the courses are offered entirely online, and you go through your classes with your cohort. You have an intensive capstone project to complete, and the internship is optional. So if you have experience working in healthcare, then you can take elective credits instead of the internship. If you are new to the field, then the internship will be a chance for you to get experience on the job in a healthcare facility. And our tuition, Colleen, you're going to have to affirm this is correct, is $558 per credit hour. Is that right?
That is the tuition rate for the 2021-2022 academic year.
Okay.
The tuition for the upcoming academic year is not out yet, but as soon as it becomes available, I'll be posted on our website. And if you have any questions about that, I would look for that sometime in the next month or two. But feel free to reach out if you have any questions. It typically doesn't go up a considerable amount, but it will go up a little usually.
Yeah, when we started in 2018, it was 540 something. So in 3 years, that's not a big jump. Yeah. Thank you, Colleen. The internship, I wanted to say, is designed to accommodate or enhance the AIT program. AIT stands for Administrator in Training. If you're going into long-term care or residential care, then you have to have this administrator in training. It's required, and I'll talk more about the AIT here in just a minute. So with our 2 academic tracks, long-term care and home and community-based services, these are the core classes that you will take. You have leadership and personal development, health systems management, which would be like your introduction to the healthcare field, and that includes public health, ethics, quality improvement, federal regulatory standards, informatics and telehealth, health policies and advocacy. And as part of that course, you do meet with lawmakers. Accounting and finance, marketing and human resources, the capstone, the optional internship, and the interdisciplinary perspectives on aging is for those in the long-term care track. And there is one that is missing from here, and that is the integrated healthcare systems. That course is for those who are in the home and community-based services track. The elective courses could come from business, public health. We have aging studies, health sciences. So you have flexibility with those electives. With the home and community-based services track, this is the course I mentioned that was missing from that previous slide. This one is required, as are the federal regulatory standards course and the capstone. So here's some information. This comes from the Bureau of Labor Statistics. It shows you the growth of different selected health and social assistance industries. This is from 2016, so it's a little bit older, but we have seen a very rapid growth here in the community-based care. And again, this is largely the result of our rapidly aging population. So starting in 2010, we have a person turning 60 every 15 minutes, and that continues through the year 2030. So for the first time, we will have more older people in our society than we do younger people. And so we've been trying to prepare for that. The long-term care track requires the interdisciplinary perspectives on aging. That'll be your primary patient population. The federal regulatory standards course and capstone, which is a 3 credit hour course that's designed for you to demonstrate your skills and your competencies from all of the courses in your program. We have a wide range of people doing different projects, and I can give you some examples of those. We've had students who have done capstone projects in hospice. We had one student who was working part-time in an inpatient hospice and part in an outpatient hospice, and then created a series of modules to help facilitate end-of-life bonding and discussions among family members with their patient relative in hospice. We had one student who was very interested in dentistry, and she developed a set of materials for long-term care administrators to use for bringing mobile dentistry to the residents. That included a copy of a legal contract. We did have one student who was very interested in the legalization of marijuana and how that could be brought into long-term care facilities. There are a lot of legal and ethical issues involved with that. So she did a structured literature review to see sort of what the current best practices are, what the concerns might be, and where they are in terms of the development of policies and law. Okay, so the AIT, you're required to complete this to become a licensed administrator. It varies by state in terms of the number of hours you have to put in. So if you're looking at a health facility administrator license, this would be your nursing homes and rehabilitation centers. You have to have 1,040 hours of direct care on the job. And generally it's done about 20 hours a week over 6 to 12 months. The way this works is there's a manual that comes through the National Administrators Board, NAB, and you're required to rotate through every department within the long-term care system. So you'll spend a couple of weeks in the office, seeing how they handle human resources and budgeting. You'll rotate through with the director of nursing to see how that section operates. You'll do dietary for a week or so. You'll go through maintenance. Every single job and department, you'll spend time getting experience and doing the tasks. If you've had classes and through this program, the state is willing to give you some hours toward that. Generally, it's about 130 hours, I think. It may be a little bit more, sort of depending on the number of business courses you've taken. And if you can demonstrate competency, then they'll waive some of those hours. The residential care administrator, this would be your assisted living facilities, you need 860 hours over that same time period. And once you complete your AIT hours, then you can sit for the licensure exam. I've worked really closely with the team here in Indianapolis, the state, the Indiana State Long-Term Care Association. I'm trying to think of the name. And they helped advise us on our curriculum to make sure that our students were prepared for this. So we will work with you to find a placement that's going to work. A couple of things that are important to note: because this is such an intense training, a lot of the organizations will ask for a commitment from you, that if they will take you on as an AIT, that you will commit to working with them for 2 years. And at that point, you may stay in the facility where you've done your AIT, or you may be promoted up to the executive director position in another one of their buildings. So we've been working with the corporate offices. They're familiar with us and with our students, I'm pleased to say. And we're at the point where they will contact us and let us know when they have AIT openings available. So I can pass it on to the students to say, now is when you need to apply. We do have a strong focus on the aging population. Obviously, if you're talking about long-term care, or even when you're talking about home and community-based services, it's largely an older population who requires those services. We know that 1/5 of our population is going to be over the age of 60, and the oldest old population, those are people 85 and older, that's the most rapidly growing segment of the older population. And they're also becoming more diverse. The non-Hispanic white population is projected to drop 24% by 2060. And I would say by that point, we really won't have a majority population. The United States is projected to become a minority majority, where we are comprised of minority populations, of which the non-Hispanic white population will be. I think we're estimated to make up 45% by 2050. The majority of older adults are aging in place, and this is often disproportionate in rural areas. There's a great need for services and agencies and facilities in the rural area. More than 1/4 of older people tend to live alone, and they are in need of supports. We know that the older people are experiencing, an obesity crisis, and many of them have chronic diseases that need to be managed. And this means increased expenditures for Social Security and Medicare. And this will be part of what you learn in terms of your finance classes, as well as the federal regulatory standards. We spend a lot of time talking about Social Security and Medicare. Hopefully, starting in January, we will have this, well, I've read that wrong. We will have a health care administration certificate, and that can be done. We're planning on having it done, separately from the degree or in conjunction with another degree program. But for our MS in Healthcare Admin program, we also have a graduate certificate in aging studies, and this would qualify you to be an expert with the older adult population. It enhances the degree. Your elective courses can include the aging studies courses that are required for the certificate, so you would get dual credit for those. And the aging studies courses are also all online, and the majority are offered in the 8-week modules. So these are the courses that you would need for the certificate. The one highlighted in yellow here is required for the long-term care track already. You would have physical dimensions of aging. This would be more like the sociology of aging, psychology. This one is less on the research methods and more about like current research on the population of interest, and then the practicum. And this practicum would be the internship. All right. To be admitted to the program, you need to have a bachelor's degree with an overall grade point average of at least 3.0. If you don't meet the 3.0, then we ask you to take the graduate record exam, and a statement of purpose detailing your interest in the program and your career goals related to either long-term care or home and community-based care. And I think our statement of purpose is limited to 3 pages. Isn't that correct, Colleen? Is that where we kept it?
Yeah, that is correct. And the GRE, we have some alternative options for students who have a 3.0 GPA lower in your undergrad. We can discuss that if that is you, but it's not necessarily always a GRE. It could be, we do a holistic approach to the admissions process. So when we review applicants, we look at not just your academic performance, but
Right.
your experiences, your references, your statement of purpose, things like that.
Right. The application requirements, there's an online application fee. We ask for your transcripts, and these need to be from all the institutions you've attended, all the degrees you've earned, a copy of your resume or your curriculum vitae, 2 professional letters of recommendation. There it is. A personal statement, no more than 3 pages, double-spaced. And if you are an international student, we ask for your TOEFL score as well. And then just a little bit about me. I'm an associate professor in the Department of Interprofessional Health and Aging Studies, Interprofessional Health and Aging Studies. And I'm the program director for the MS in Healthcare Administration. My background is in psychology predominantly. My PhD is in gerontology, which is the study of aging and the aged. I have graduate certificates in statistics and medical behavioral sciences with my PhD. So I consider myself to be a researcher. My areas of greatest interest are where older people decide to live and how they manage that. So I've spent a lot of time doing research on relocation decision-making and adaptation once they've moved, and also aging in place and how people use home and community-based services and supports to be able to do that. And also looking at not just their physical health, but their psychosocial health too, how engaged they are with their communities, how connected they are. I've been doing this research since 1999. So we're looking at what, 22 years now, I think. Yeah. And, you know, I think as with anybody else, we come to our fields because of a passion we have or an experience we've had. And most of mine has come from, you know, my own family. I had older parents. They were in their 40s when I came along. I spent a lot of time with both sets of grandparents. My mom taught at the senior center and the nursing homes. And so a lot of my childhood was spent playing under quilting frames and threading needles for older women and listening to their stories. And they made an impact. Obviously, they made a strong impact on me. And I want to improve the quality of life for older people and make sure that they get what they need to reduce the number of health crises, falls, and make sure that those who are working with the population are well educated and have that same degree of passion and integrity in helping. So here's the link to apply. We have a final deadline of July 1st for applications. We start in August. If you have any questions about the program, the AIT, the capstone, anything related to the courses, you can contact me. Anything about the process, the applications, the system, etc., then you need to talk with Colleen. Colleen knows all of that. I have to go back and ask her exactly how that system works and what she needs in a timely way.